In this lecture, we will discuss electrodes, specifically how they are able to sense electrical activity and translate it into waveforms on the EKG. In recording an EKG, electrodes are placed on the skin. There are many different electrode systems. The one used in the standard 12-lead EKG uses a 10-electrode system. 4 electrodes are placed on the limbs, that is 1 on each limb, and then 6 electrodes are placed along the precordium. These 10 electrodes are used to monitor 12 leads. So what exactly do these electrodes do? Well, simply put, they sense electrical activity in the heart. In other words, impulses traveling below these electrodes are captured and sensed by them. The EKG machine then registers the electrical activity at the electrodes and converts it into waveforms on the EKG. So if you look here, this is our impulse here in red. Okay, it then goes to our electrode, which is this point, and then is translated into our EKG on our leads. Okay, so from impulse to electrode on the skin. All right, so imagine this is the heart activity, this is the skin, okay, and this is the EKG, what we actually see on our leads. Okay, you can think of these electrodes as cameras situated around the heart, capable of giving a three-dimensional picture of the heart's electrical activity. And this is exactly what the EKG is. If you look here, we have these cameras that are placed all around the heart, okay, and they're giving us a three-dimensional view of the electrical activity. All right, and that's exactly what the EKG is doing. It's taking these impulses and it's having electrodes that are placed all around, right? We said 4 on the limbs, 6 along the precordium in our 10 electrode system, all right? And then it's translating into the EKG, giving us a three-dimensional image of the heart's electrical activity. We can thus say that the electrocardiography is the process of recording the heart's electrical activity over a period of time using electrodes placed on the surface of the skin. Now imagine that this red impulse that we have here is a positive depolarization wave that's moving from left to right. As the impulse moves away from an electrode, it results in a downward or negatively deflected wave. So again, let's just erase some of this here. Okay, and this red impulse that we're talking about here is, let's imagine it's a positive depolarization wave and it's heading from left to right. Okay, so this is one electrode, this is our second electrode, and this is our third one. It's moving away from the left one, or the first one, and going towards the third one. All right, and we're saying that if it's moving away, okay, so here's electrode 1, and the impulse is moving away from it, we're going to see a negatively deflected wave. Okay, so imagine this is our baseline, okay, and our wave is deflected downwards. Okay, so downwards, and that's what we call a negative wave. Now as the impulse moves towards an electrode, it results in an upward or positively deflected wave. Okay, so we have here, we've labeled 3, this electrode, and now we said the impulse is moving from left to right towards that, and because of that, all right, here we'll draw our, let's use a different color, our baseline here, and because of that we have our baseline and everything's above it. We call that a positively deflected wave. Okay, now finally, when the electrode is somewhere in the middle or perpendicular to the electrical impulse, the part of the electrical impulse going towards it will be positive and then become negative as it moves away from that electrode. So if you look here, okay, we have our electrode again going from left and all the way to the right. So it's as it's moving towards, here is electrode number 2, as it's moving towards it, all right, we'll draw our baseline again. Here's a baseline. As it moves towards that electrode, it's deflected upwards, so it's positive, and as it moves away and past that, it's negative. Okay, so this is what we call an isoelectric wave, where it's both equally in amplitude, both above and below the baseline. Okay, and that's because it's perpendicular to the wave, right? We see, let's just erase some of this here. What we have here is our impulse moving this way in our electrode here, so this is perpendicular to it. Okay, hopefully that makes sense. Let's briefly review what we discussed before we end. So again, electrodes sense electrical activity, our electrical impulses. When we talk about the standard 12-lead ECG, we're using 10 electrode system. 4 on the limb, so we have 1 on the right arm, 1 on the left arm, 1 on the right leg, and 1 on the left leg. And then 6, they go across the chest or the precordium, and they monitor 12 leads. We have these cameras or these electrodes, okay, think of them sitting all the way around the heart, and because of them, they're able to capture or take almost pictures of the electrical activity. All right, and then from that, it's able to translate it into the EKG, what we see in our leads. Okay, now EKG detection, if we have a positive impulse, which we said this is a positive impulse moving from left to right, as it moves away, we see a negatively deflected wave. As it moves towards, okay, we see a positively deflected wave. And if it's perpendicular to the impulse, we call that an isoelectric, right? Where we have both a positive and negative deflection, okay? And sometimes you may see it just as baseline, okay? That's what we call an isoelectric if the impulse is moving perpendicular to the electrode. Well, that's the end of this lecture. We discussed electrodes, specifically how they are able to sense electrical activity and translate it into waveforms on the EKG. I hope you learned something.